In today's session, we covered the topic of alcoholic liver disease briefly. When you consume alcoholic beverages, the alcohol is quickly absorbed into your bloodstream and eventually reaches your liver for metabolism. Within the liver, specialized enzymes such as alcohol dehydrogenase and aldehyde dehydrogenase work to break down the alcohol into acetaldehyde and then into acetate. This acetate can either be used by the body for energy or eliminated. Approximately 10% of the alcohol consumed is excreted unchanged through breath, urine, and sweat, which is why individuals may have a recognizable alcohol scent on their breath. Understanding this process of alcohol metabolism is vital in recognizing how excessive alcohol intake can contribute to liver damage and conditions like alcoholic liver disease. The effects of alcohol can vary depending on its concentration in the blood. For example, at a blood alcohol level of 200 mg per deciliter, individuals may experience drowsiness and impaired motor functions, while at 300 mg per deciliter, it can lead to stupor and potentially coma. Consuming 80 grams of ethanol per day, which is equivalent to approximately 6 beers, significantly increases the risk of developing liver disease. Consuming 160 grams of ethanol per day, equivalent to 12 beers, for a period of 10 years can result in severe liver damage. Over time, chronic alcohol abuse can result in alcoholic liver disease, a serious condition that can be fatal. There are three main types of alcoholic liver disease. The first type is fatty liver, also known as steatosis, which occurs when there is a buildup of fat in the liver cells. This condition can be reversed with lifestyle changes such as reducing alcohol consumption and maintaining a healthy diet. The second type is alcoholic hepatitis, which is inflammation of the liver caused by heavy drinking. This condition can range from mild to severe and can lead to serious complications if left untreated. The third type is alcoholic cirrhosis, which is advanced scarring of the liver resulting from long-term alcohol consumption. Unlike fatty liver and alcoholic hepatitis, alcoholic cirrhosis is irreversible and can lead to life-threatening complications such as liver failure and liver cancer. Alcoholic liver disease is influenced by various predisposing factors such as female gender and certain ethnic groups like Black and Asian individuals. Women are more prone to alcohol-induced liver damage due to high estrogen levels and lower alcohol dehydrogenase activity. Individuals with lower aldehyde dehydrogenase activity, often found in Black and Asian populations, are at a higher risk of alcoholic liver disease. Genetic predisposition and comorbidities like hepatitis B, hepatitis C, and iron overload also play a role in the development of alcoholic liver disease. Alcoholic steatosis, also known as fatty liver disease caused by alcohol consumption, is characterized by the buildup of excess fat in liver cells. This condition is a result of impaired fat metabolism, as the oxidation of alcohol generates an ADH, leading to elevated lipid synthesis and reduced fatty acid oxidation. Furthermore, alcohol disrupts the production and release of lipoproteins, contributing to further fat accumulation. On a macroscopic level, the liver appears enlarged and has a yellowish hue, while microscopic examination reveals the presence of large fat droplets within liver cells. If left unchecked, alcoholic steatosis can progress to more severe liver diseases, posing a serious health risk to individuals who continue to consume alcohol. Alcoholic steatohepatitis is a condition that occurs in about 35% of alcoholics, characterized by liver cell damage and inflammation. The pathogenesis of this condition involves various mechanisms induced by alcohol consumption. Free radical formation leads to damage of liver cells, while decreased methionine production impairs the production of glutathione, an antioxidant necessary to neutralize free radicals. Additionally, the production of acetaldehyde, a toxic compound to liver cells, contributes to lipid peroxidation and the formation of acetaldehyde protein adducts. Macroscopically, the liver may show signs of inflammation such as redness and swelling, possibly appearing bile-stained. Microscopically, liver cell inflammation, necrosis, and swelling can be observed. These pathological changes highlight the destructive effects of alcohol on the liver in individuals with alcoholic steatohepatitis. Alcoholic cirrhosis is a serious medical condition characterized by extensive damage to the liver. This damage is caused by chronic alcohol consumption, which leads to inflammation and injury of hepatocytes, the primary cells in the liver. The production of inflammatory cytokines by various liver cells further exacerbates the damage, resulting in the activation of stellate cells and the formation of fibrous tissue within the liver. This fibrosis disrupts the normal flow of blood and nutrients to the liver, leading to a lack of oxygen and eventual cell necrosis. Despite efforts of the liver to regenerate new cells, the ongoing damage caused by alcohol consumption often outpaces the liver's ability to heal itself, eventually leading to the formation of nodules and the development of cirrhosis. It is estimated that 10 to 15% of chronic alcoholics will develop cirrhosis, with men between the ages of 40 and 70 being at greater risk. Complications of alcoholic liver disease include liver failure, hepatic encephalopathy, severe bleeding, hepatorenal syndrome, hepatocellular carcinoma, and a higher susceptibility to infections. Consuming alcohol can have detrimental effects on various systems in the body besides the liver. It can lead to issues such as gastrointestinal bleeding, thiamine deficiency, cardiovascular problems, pancreatitis, fetal alcohol syndrome, increased cancer risk, and malnutrition. Alcoholic liver disease can manifest in a variety of clinical forms. When it presents as alcoholic steatosis, individuals may experience symptoms like abdominal discomfort, nausea, and fatigue, along with hepatomegaly and a slight increase in liver enzymes during examination. On the other hand, alcoholic steatohepatitis can lead to symptoms such as malaise, nausea, loss of appetite, jaundice, and right upper abdominal pain. Physical indicators like tender hepatomegaly might suggest inflammation. If these symptoms and signs are left untreated, they can progress to more severe forms of liver disease. It is important to be aware of these potential risks associated with excessive alcohol consumption and to seek help if needed to prevent serious health consequences. Alcoholic liver disease has a relatively good prognosis, with a 5-year survival rate of 90% in patients who abstain from alcohol. However, it is critically important to understand that continued alcohol consumption can have a detrimental impact on the prognosis, increasing the likelihood of complications such as cirrhosis and liver failure. Therefore, it is imperative for individuals diagnosed with this condition to seek treatment and make necessary lifestyle changes in order to improve their overall outlook. Regular monitoring and follow-up care are essential components in managing the disease and preventing further damage to the liver. By taking proactive steps and adhering to medical advice, individuals can greatly increase their chances of a successful outcome and better quality of life. These findings underscore the dangers associated with excessive alcohol consumption and emphasize the importance of being mindful of how much alcohol one consumes in order to protect the health of their liver. If you're interested in delving deeper into this subject, we recommend exploring the latest editions of Robbins and Cochrane's Pathologic Basis of Disease and Muir's Textbook of Pathology. These reference books offer a detailed and comprehensive understanding of the complexities of the disease. Thank you for tuning in. If you found this information enlightening, please remember to like and subscribe to our channel for more educational content. Feel free to leave any questions or feedback in the comments section below. We are excited to bring you more insightful videos in the future. Stay tuned for our next session.